today, and I want to bring us back to where we started. In the early days of the pandemic, we were dealing with a deadly, highly transmissible, and highly mutating virus. As we planned our public health strategy, we prioritized saving lives and the prevention of future harm and keeping our healthcare system at or below capacity. And that strategy was successful. As I said at the beginning, the Biden administration's implementation of the largest, most successful vaccine administration program in history prevented an estimated 3.2 million deaths. As an added bonus, it saved the United States over $1 trillion in medical costs. So as we wrap up this conversation, and as we have future conversation this subcommittee, I just ask that we keep our eye on the ball and focus on the prevention of harm and the prevention of getting infected. This will almost always involve the proven public health measures that we know work, such as vaccines that are known to be safe in a public health perspective, effective, and vaccines that have saved lives. And let us be cautious about the impacts our words can have. Nuance is good, yes, but we cannot get to a place where we are explicitly or implicitly sowing distrust in COVID vaccines by focusing on the small percentage of, for example, the severe side effects, when we know at a population base it is safe and the symptoms are mild. And it has helped us get to where we are today. So we have a process to study vaccines, and they were studied, and we know who are at high risk because of those studies, and there are contraindications to people getting this vaccine. And there are risks, or some people, and those are the people that physicians use the data to recommend not getting the vaccines. So let's be nuanced, let's use our words carefully, and let's sow trust in public health measures. Let's go back to understanding that this virus spreads from airborne, oral aerosols to the public, and that any covering blocks that aerosol from leaving your mouth. Now, some coverings are better than others, some aren't as good, but by reducing those molecules, you reduce the risk of transmission. So yes, masks help to reduce the risks of transmission. Just like masks, if these molecules are transmitted by your mouth, when you speak, you cough, you scream, or sing, then the further you are, the less likely you'll come by being infected with a droplet that will either breathe in through your nares, your mouth, your eyes. So yes, in these circumstances, social distancing is a preventative measure. It's a public health measure. So vaccines do work. Vaccines are safe. I do not wish anybody, regardless of whether a natural infection can cause a more robust immune response, to go and get infected, or to want to get infected, or to disregard the importance of a vaccine. I don't want a Republican or a Democrat or anybody to get the symptoms, to have enough viral load to transmit it to a more higher risk person, or to risk themselves being hospitalized or even death. And those who have been vaccinated, if you fall under the category of being high risk or not immunocompetent, then I would still recommend to take all the precautions, because you can still get sick and you can still be hospitalized and you can still die. So it is nuanced, and we have to work within that nuance. And I do believe that in future pandemics, we shouldn't be stuck that our unknown viruses that can kill people, that are rapidly transmissible, that we should be focusing on just disregarding safety precautions by saying that your getting infected is going to be a protection. So let's just be careful on the way we present this, and let us work always to put people over politics. Those are my hopes for this subcommittee, and thank you, Mr. Chairman. I yield back.
I thank the ranking member, and I will say that I continue to look forward to working with Dr. Ruiz through this process over the next year and a half, as we have worked well together in the past, and I think we will continue to do our best to possibly have differences of opinions, which doctors sometimes do, and move forward with something that we can present to the American people as a better pathway for the next pandemic. You know, we're advocating for a multi-pronged strategy to defeat COVID or the next pandemic. A majority of Americans have had COVID and have had infection-acquired immunity. We can learn a lot from that, and we should try to. I don't believe that herd immunity was ever the Trump White House's strategy. I know people talked about it. I don't think that was ever the strategy. Protecting the most vulnerable, we saw emergency use authorization for the vaccine, and it was there for the elderly and those with comorbidities. And that was always a priority. And reality suggested that this contagious disease would continue to spread throughout the nation. Understanding infection-acquired immunity and protections it offers is essential, in my opinion, in order to resume normal life in America and end things like lockdowns. It needs to be considered. And false statements, no matter where they were coming from, especially if they're coming from a leadership position, is wrong. And we can look at studies, and we can look at comparing Sweden and Michigan. You know, Michigan had severe lockdowns and mandates. Sweden did not. Sweden had half the deaths. What's up with that, right? Why can't we look at that? So, you know, and, you know, as doctors, you can, if you're honest with yourself, as doctors, researchers, you can look at a study and say, this is a flawed study, or this is a very good study. This is a very good study without any type of bias whatsoever. We know how to do that, and we need to do that and not pretend. You know, I'm curious because I haven't ever seen anything on the initial studies, and I was very involved. We were involved with this Doctors Caucus, looking at what was taking place with Operation Warp Speed and understanding the technology, but also how the studies were being conducted. Normally, before FDA approval, you have 8,000 to 10,000 people in a study. You have 30,000 to 40,000 people, and I applaud those brave Americans that got in these studies that helped us produce a vaccine. The one thing I'm curious about is those that got the placebo and got COVID, did we look at their immunity from it? Did we make that part of our study? As far as I know, we did not. We missed that. We should have done that. That should have been part of what we're doing. Lesson for the future, in my opinion. You know, we had two or three doctors on this very committee that have actually been treating patients during COVID. And, you know, I can tell you that they feel, and they said today, that, you know, infection-acquired immunity was ignored. And when they spoke about it, they were censored. These are facts that are coming out. We got to address this and quit playing politics with it and say that was a wrong thing for any government to do on behalf of the health of the American people. Look, I got vaccinated. I also was out in military uniform with the National Guard testing people, driving up testing. I was out giving shots with the National Guard, and when my local hospital said, can you come out? Or can you come out to the fairgrounds and vaccinate people as they're coming through to be part of this mission? So when the implication is that, you know, people on one side or the other are saying, oh, it's natural immunity only, that's not true. And it doesn't help this committee when we have comments like that coming from this committee. Let's be serious about what people were actually doing and saying and what their concerns are. And by the way, an opinion is far different from misinformation. And if we're not allowed to have opinions in the medical community anymore, then we are doomed. We are absolutely doomed going forward. More times than one, I'd say to a patient, here's what I believe, and if I see some hesitancy, I say, I would like you to get another opinion. And I think that's a wise thing to do. So when we have opinions, it's not necessarily misinformation. But the fact of the matter is, false statements were made by many. Whether they intended them to be false or they knew they were false, I don't know. But they were false statements that were being made. And some of these people served on both administrations that were doing this. I don't think it helped with that. That does dissipate trust in our public health system. As I said earlier, I had recommended under the Trump administration, let America hear from the doctors treating COVID patients every day. Not someone sitting in a lab, not someone that's not bedside with anybody. Let them tell us what's actually going on. And I think that is a lesson learned that we have to move forward. Now, I heard Ms. Ross say she gave credit to the Trump administration for creating a vaccine, but I don't think it helps when a candidate for office says, well, if it's made during the Trump administration, I'm not going to take it. That didn't help build public confidence in what was going on. And, when we talk about say something safe, the honest discussion you have with your patient is, we think this helps, and here's why. But also honest is, I don't know what I'll say 5 years from now or 10 years from now. And here are some of the adverse events that we are seeing. And you have a discussion with your patient and you decide what's best for you. Look, many people got COVID. They got infection-acquired immunity. It's not necessarily that they didn't want to get the vaccine. It's because it wasn't available to them. And there's a lot of information we could gain from those people that got COVID and how their body responded to it. Some didn't even know they got COVID. Some people got tested or checked for antibodies and found out, oh, I must have had it. I don't know when. This is all important information and data. And it's very important. And you know what? You're not supposed to hear from Dr. Facebook or Dr. Social Media. You're supposed to talk to you. You, Dr. Tan. You, Dr. McCary. You, Doctor. That's who people need to go talk to. And we have to supply doctors with accurate data without flawed studies. That's the important thing. That's one of the takeaways that we need to come away with from this committee. One thing I never heard about, and I've never heard anyone discuss or studying, the possibility of hyperimmunity. You've had COVID, you've had the vaccine, you get the booster. What are the effects of that? Those are fair questions. Hyperimmunity is real. So I hope that we can continue to go down this path and have good conversations with experts and amongst ourselves, to where we can really have some good results and good recommendations to make for the future. With that, and without objection, all members will have 5 legislative days within which to submit materials and to submit additional written questions for the witnesses, which will be forwarded to the witnesses for their response. If there's no further business, without objection, the Select Subcommittee stands